It seems that people fall through the cracks. It puts me in a place where I'm very keenly aware of the power and the privilege and the honor of the human relationship that I'm able to have, the intimate, getting to know everything about a person, doing your best to ease their struggle. What's amazing to me, though, is that my colleagues who are nurses, who are the ward clerk, who are the physicians, this is why we're all in it, all of us. We all share that. And there's great hope, because we all want to get to that mission of caregiving. We need the resources to do it. We have the resources to do it. Single payer would be a very good first step. It's an incredible breath of fresh air to have the chance to explain to the leaders of the nation that we can do this. We have what it takes to make sure that everyone in the country, absolutely every human being in the United States, has all the necessary medical care that they will need. It's really the least amount of human dignity that we should expect from a great democracy.
Some hospitals charge over 1,000 times what their actual costs are. And they try to get people in for elective surgeries. They emphasize the revenue units in the hospital that bring in the most money. That's not about patient care. That's about a profit-based system. Whether you call yourself not-profit or not, it's a profit-based system in hospitals. We say no. We're going to give you a budget to provide patient care. When we talk about single payer, we're also talking about regulating prescription drug prices. The only country in the world that doesn't regulate prescription drug prices and have both purchasing of prescription drug prices system-wide is the US. What country in the world has the highest prescription drug prices? Yes. It's not a coincidence. We're talking about a democratic system. We're talking about a system that doesn't depend upon 3 layers of review and grievances when care is denied. We're talking about a publicly accountable system that is responsible to the people because we are the ones who created it. And that level of accountability can never exist as long as the insurance companies are in charge.
So you're going to be lobbying here in the House of Representatives. The issue on the mind of the members and the staff, and this is deeply, profoundly what they're thinking about right now, is not health care. It's not even really the VA, I'll just summarize to that. It's really Benghazi. Because, well, it's obvious why. And it's Benghazi, and there's a decision, the speaker, or the minority leader today decided that 5 Democrats would serve on the special Benghazi panel is being created. And I can tell you from just casual interaction with staff members here, that's what they've been focused on, because this place, the dynamic of this place, that's real. So realistic for them is thinking about Benghazi. Now, we have a different understanding of what realism and reasonableness means. When Michael's talking to sort of tick off the pieces of the healthcare system as it exists now, that is unreasonable. And it is unrealistic to think that we can fix it by tinkering with it, right? It is unreasonable that we pay outlandish amounts for pharmaceuticals that cost close to nothing to manufacturers. What you're about to do, you should cheer yourselves, right? It is unrealistic and unreasonable to say the richest country in the earth lets 45,000 people die for lack of care. It's unreasonable for the richest country on the planet to spend more money by far than any other industrialized country and get far worse care, right? That's unrealistic. That's unreasonable. And to think that we can do a little bit, change the system a little bit, and affect that, that is unrealistic. Single payer, Medicare for all, that is the profoundly realistic and reasonable response to our nation's healthcare problem.
I never met a girl could make me feel the way that you do. Look out, baby, now here I come. I'm bringing you a love that's true, yeah. Get ready. Oh, baby, start making love to you.
Illinois, Missouri, come on.
I said I'm on my way, baby. If you wanna play hide and seek with love, let me remind you. Alright. The loving you're gonna miss and the time it takes to find you. You're not a sight. What twiddly-dee, now twiddly-dum. Look out, baby, now here I come, yeah. I'm bringing you a love that's true, yeah. Get ready. Oh, baby. I start making love to you. Get ready. Oh, say. I said I'm on my way now, baby. Oh.
It was a contrast between what I've witnessed as a physician and as a patient in Canada and in the U.S. So I've been a physician there for over 20 years, and I have never had trouble looking after my patients. I have never had trouble getting an urgent MRI when it was necessary. If I had a sore knee, I had to wait 2 months for an MRI, but I can handle that. I had major cancer treatments. I had superb care. I did not have one single bill to pay. I could just focus on care and getting better. This is my Canadian health card, and I can travel through the country. It fits in my wallet, and that's all I need.
That's all you need.
You get it when you're born, and you lose it when you die.
I love that.
You're automatically enrolled.